الآن المحاضرة الأخيرة بعنوان الدول المتصلة نظرة جديدة لعمل المستقبل الحكومية. Mr. Bolang, the Senior Vice President Global Market Segments and Customers Programs from Unify.
So good morning. My name is Paul Lang. I'm the Senior Vice President of Market Segmentation and Customer Programs at Unify. And I hope during my presentation I'm going to explain what that very long title actually means. Okay, so let's tell you a bit about Unify. We're in around 60 countries worldwide. We have a range of solutions for communication and collaboration. And I'll get into that a bit more and why it's relevant for the government marketplace. We're ranked the market leader by the top analysts, and we power around 75% of the Fortune 500. In terms of what I'm going to talk about today, with specifics about industries and also about our portfolio, is the solutions that we have that are designed for government and healthcare, whether it is an application-specific solution or where we can cleverly provide an application that's a traditional horizontal application into the government marketplace. So we have a range of applications from contact centers for that customer contact. We provide all forms of conferencing and collaboration, web, audio and video. We have a robust, highly scalable, as well as a small business platform, IP communications. And then we have a range of mobile collaboration solutions backed up by an extensive portfolio of professional services that can be managed, also aiming around security, which today is tending to become more and more important in the marketplace. So either these are products or a range of security consultancy services. We provide access control and identity verification for the UK police, as an example. We provide a range of disaster recovery and crisis management solutions, all of which is around threat detection and also migration control within the small and indeed the large enterprise. In terms of how you wish to deploy it, we offer choice. Very highly scalable, can be offered as a public cloud service, a private cloud service, or some combination of the two. And we can virtualize our services in your data center using a variety of technologies. The verticals that we focus on, and I'm going to focus on two of these for today, are very much in the public sector across federal or central government, state or local government, and we offer a range of applications in education, for example. One of our key customers there is a global brand name, which is Oxford University. We provide solutions and products in healthcare, focusing very much on the hospital or the provider side of things. Financial services, we're in banking, capital markets and insurance. Manufacturing, focusing heavily on automotive, and more recently focusing on energy and utilities. In each case, we have a deep field expertise within the markets we serve. We have targeted content and a range of supporting materials to help you understand our solutions, and hopefully we can tell you more. And then we have specialized vertical solutions, some of which I'm going to go on and describe in a lot more detail today. So the focus of today, bearing in mind this is an e-government conference, we're going to focus very much on the government side of things, and also focus on a little bit on healthcare and how that ties into the market. So this is it's a simple slide, But it's the result of a lot of research around the various marketplaces in the world as to the challenges that the government organisations that we talk to see in their day-to-day operations. And this has been shown in the presentations that have preceded me this morning, in terms of the people need to be secure, the systems need to be secure. Governments now are having to be more responsive, more effective, and they have some challenges, and these are just 4 of them. They're trying to balance their budgets from balancing cost of delivering services and the amount of services they deliver. There's pressure on consolidating their infrastructure. We have a number of examples in the United States and the UK where government departments are sharing services amongst them. So no longer a dedicated service for one government department or one local government department. They're sharing those services in a consolidated infrastructure. They're of course trying to increase productivity of their workforce. And then finally, needing to engage more and more with their citizens across a variety of media as they move further and further into digital government. And whether you're in any part of the world, as Eric Garcetti says, who's the mayor of Los Angeles, I've seen this in meeting with various customers and hearing from other presenters here this morning. You can read this yourselves, but it's now, so you can't wait. It is engaging with the citizens. It is providing them those tools so that they can empower themselves and they can deliver themselves and not have to go to City Hall, as Patricia just said in her presentation. And this is true everywhere I visit around the globe. So there's a kind of a catch-22 going on within the government. While budgets are being reduced, there are more demands for services, and the expectations from citizens are raised. Social media means that you can't actually expect to place anything in social media and not expect it to go everywhere. And then the consequences of social media plus the other expectations means that consequences are stiffened. So engaging citizens on their terms. They want to contact you when they want, how they want, and from where they want. You no longer have the choice of expecting them to go to a certain location to get in line for a variety of services. You're having to anticipate their needs, and when there is a crisis, respond appropriately. And basically give the right answer, the first answer at the right time. And finally, everything to be done via automation. In terms of how it could look like from a deployment, and this is my most technical slide, so I'm not going to get down into it, but you have a situation where technology is at the core of the connected state or connected government, but it's communication services that are providing that productivity. It's contact centres, but it's all really about citizen engagement. It's providing solutions for mobile workers. I mean, we have a situation where we have the notion of, if you take an Olympic race, the relay race, where you hand off the baton as either 100 metres or 400 metres relay, you have a situation where either on-call workers or remote workers are often not where they should be or not where you'd want them to be. So you have to find a way of contacting those folks when they're out in the field or where they're remote from the office. And by a simple feature that we call, and I'm just using this as an example, our one number service, you can find anybody anywhere. And it's like you're going around and you're handing off the baton to that person who needs to be in contact next. Security, both physical and logical, video communications, workflow. And in my next slide, I'm going to talk a little bit about public safety. And the gentleman from IBM who's presented earlier on brought to mind what we're doing at Baltimore County. So Baltimore, for those of you who don't know the geography of the United States, is on the eastern seaboard of the Atlantic coast in America. Quite a big city, 2.5 million people. And they take over 700,000 in emergency calls every year. And so what we are providing is the platform for them to receive calls and then dispatch personnel, be it police, fire, or ambulance. And we're doing that across the traditional voice call, the texting. Why you'd want to text an emergency number service, I don't know, but maybe there's a situation where you can't actually make a call, so texting is safer, and also extending video to those calls. We're also able to have an application to dispatch those workers. And this is very similar to a solution we have deployed in Dubai with the Dubai police. A very similar situation but it's highly scalable, able to handle hundreds of thousands of calls at any time, not just 700,000 calls a year. It's highly redundant, highly resilient, highly secure, and we had a situation that was both a fortunate or unfortunate situation where you may have seen in the news there were riots just in the last year in the city of Baltimore. This is the county of Baltimore, which is on the outside of the city. And this platform was able to lend support and take overflow calls during those unfortunate events. Looking at it from a different angle is providing control for, in this case, the city of Stuttgart in Germany, controlling and providing insights and workflow solutions within the metro system within Stuttgart. Similar situation is deployed in Riyadh using very, very similar technology, slightly different deployment. And what you have is a really easy to use interface for the people who are controlling those trains. As you would expect, a very robust architecture for high availability to help run that train network. And over a period of time, it's proved a really good total low cost of ownership. Final example in this area is the Australian government. And this is where across a vast geographic area with pockets of population absolutely everywhere, we're providing solutions across coordinating all of this going on. These are the guys in Australia who actually are the Environmental Protection Agency. And so we are able to transition from existing solutions into a new generation of solutions where high reliability and keeping the project on time were absolute musts. And the solution for them had to be easy. There's an advert in the United States with a big round button called the easy button. And these guys were insistent on this was of no disruption to them, which is what we achieved. And overall, a total lower cost of ownership. Transitioning to a related area is that of healthcare. So again, you see a similar set of goals. In fact, we've done a study worldwide, and these are top 4 of the goals we're seeing in the healthcare provider or the large university-style hospital environment that are absolutely key for them to achieve. You see the lower costs coming through as a theme. We need to keep up the innovation, but people don't actually want to spend more. They want integration into their patient record system, which is reducing their losses or their liability and also maintaining a high level of security around that. There's a greater efficiency of cost and productivity focus, and I guess we'll get to it, but last but by no means least, actually better patient care. In fact, there's a book that came out earlier this year by a doctor, a gentleman by the name of Eric Topol, and he's seeing a changing set of dynamics in the healthcare industry that as a doctor he says is long overdue. And the title of his book is "The Patient Will See You Now." And there's a phrase in the medical profession, "the doctor will see you now." So he believes there's a transformation as we as citizens, or if unfortunately patients, we're probably our best source of information about ourselves. And with the advent of these things, these smart watches and smartphones and smart everything, we know more about ourselves than ever we did before. And the consultation with the doctor, according to Eric Topol, is going to change, and the medical industry is probably one of the last industries where the customer is always right, as they are in other industries. But in the healthcare industry, very, very soon, the analogy would be that the doctor is going to be still in charge, or the CEO, but they're going to take a lot of advice from the patient, who's soon to become the COO in their own consultation. Time will tell how quickly that transitions. The other thing also, and I was reminded checking into the hotel next door yesterday evening, that the medical industry could take a lot of guidance from the hospitality industry. I mean, when I checked in last night, a colleague had arranged the room. The gentleman that greeted me on my check-in knew my name, knew my Marriott frequent hotel number, knew my room preferences, was able to check me in very, very quickly and get me up to my room after a pretty long flight. And so if the hospitality industry can do it based on your profile, why can't the medical industry? Because they can send you a reminder out that, you know, you've got a hospital arrangement coming up. They can push updates that are timed. They can greet you by name. Often it's a stressful situation if you're going for some form of procedure within the hospital. They can offer you a range of in-room services catered to what your treatment is and what your stay. When you're leaving, they can push you a survey, they can push you updates, and then finally, after you've left the hospital, they can send you a post-stay reminder to take the medicine, follow up for a visit. And so we can write applications like you can see on the right there, whereby at your bedside you can see all what's going on. It's updated in real time. It's integrated into the hospital records. And funnily enough, the strange point at the bottom, it can reduce food waste. I haven't got the precise percentage, but over 30% of food in hospitals is wasted because nobody's chosen their meal. The meal gets delivered, it's not what the patient wants, so it gets thrown away. So a strange but obvious byproduct of information that can be brought to bear. There's also the ability to collaborate, and collaborate on either the terminal that you saw before or some form of handheld device. In most hospitals today, the medical profession or the medical teams work in teams. So there tends to be a lead consultant, there tends to be some junior doctors, there's a range of nursing people, and then they're linked to what you'd call back office functions. But in this case, they're linked to the pharmacy, they're linked to the radiology or the X-ray teams, they're linked to local community clinics. And so if we introduce collaboration technology into their daily work routine, we can help make them more productive, and we can improve productivity, and we can improve patient care. Because a lot of the collaboration tools are around knowing who's available. And so one doctor may be available, but only available for text. He can't take calls. Or perhaps can only take email. Or perhaps is available on video. So that presence or that availability would be known on a variety of devices. The connection is instant. The connection is not only instant, but you're actually connecting with the right people. So you're not trying to find an unavailable resource. You're not trying to hunt down an X-ray technician who's left and gone home. You're connecting with the right people at the right time to get the patient care and the patient case improved. It can be done at the point of care, either on a terminal or on a device, whereby you don't have to leave the patient. You can just use your smartphone, your tablet, to actually help the patient care in that situation. You have flexibility, and you have flexibility across a variety of media. And then finally, as we move more and more into the mobile world, where there are 2.5 billion connected internet devices, it's taking advantage of the computer or the device that's in your hand to deliver that care. We integrate it into the medical workflow, we integrate it into the medical teams, and the same could be true going back to the government scenario of what's going on for the mobile workforce or the office-bound workforce in the government sector. Couple of examples. Penn Medicine is in Pennsylvania. They've actually used around, I think it's closer now to 350 of these bedside terminals that was in the show. They connect to, in this case, Siemens Healthcare, Saurian applications. They use enterprise document management, and they also integrate into the medication, so the medication scenario that actually goes out there. The good news about this, and you see the quote from the Vice President of IT, a side story here though was they started off with 10 of these terminals with only a certain amount of doctors able to access them using like an RFID badge to log them on. Within 3 weeks, we were being pestered or asked to deploy more of these terminals because the physicians found them so helpful. The other thing is they're also very integrated into the security standards, which is HIPAA, and they also can do the customer satisfaction scores, which is the HCAP scores there, that they are required to do by the US government. If they don't meet the HIPAA scores, they won't get funding, the Medicare, Medicaid, or the public funding for healthcare. And if they don't meet their satisfaction scores, which is the HCAP scores, they could get fined. And the fines are up to $1 million a day. So there's a significant advantage in using technology to help you run your business. The second example is a very, very large hospital in Helsinki in Finland. And here, and I apologise for the stripe down the slide, but underneath the slide it says that they're making time for nurses to manage their tasks. 20% savings in 4 years. They've been able to increase their volume to handle patient inquiries by 300% and approximately 27% savings on a voice platform, the healthcare terminals across one of the largest hospitals in Finland. And so another success story, but again, focusing on making people more productive, saving costs, and in this case, over a long period of time with sustained savings. So, my final slide, and I'm just within the time limit, I think. What are we doing? We set out the goals at the beginning, both in government and healthcare, and I hope I've shown you in the case studies that we have reduced costs, that we have proved staffing benefits both in the government and within the healthcare industry. Staffing benefits across the page, resources through integration into the back-end systems, and more importantly, satisfied and engaged citizens across the board. So hopefully I've shown you in a short presentation how by deploying these applications with a range of technology options, we can offer a new way to work in both public service and in health. Thank you.
Thank you, Mr. Ball.